The confirmed COVID-19 death toll surpassed 100,000 today in the United States, the world's most powerful country. The first official report of a coronavirus-related death in the U.S. came on February, but President Donald Trump declared a national emergency on March 13th, and it was not until March 16 the White House reversed its previously dismissive stance and announced anti-epidemic guidelines. Those 100,000 lives were lost in merely 3 months. But a recent study shows if measures had started earlier, tens of thousands of deaths could have been avoided. Data shows if the country had begun imposing social distancing measures 1 week earlier, it could have prevented 36,000 deaths through early May. If nationwide lockdowns had begun on March 1st, about 83% of the nation's deaths would have been prevented. And one confusing fact is, 3 months have passed, it is still a question whether or not to wear a face mask. Trump keeps refusing to wear one, while Democrat leaders follow the CDC advice that all Americans wear face coverings in public. It turns out the U.S. pandemic struggle has been politicized over election concerns, and wearing face masks, which can slow the spread of this highly infectious disease, has become one of the topics of fierce partisan fights. As the worst public health crisis, the pandemic tears through the U.S. economy. In the past 3 months, millions of Americans lost jobs, tens of thousands of businesses were forced to shut down, while consumer spending, retail sales, and production plummeted by record amounts. Facing the virus-hit economy, the U.S. government chose to reopen the country, though many pointed out reopening should be driven by data and science, not the calendar. Infections and deaths are still growing as we speak, showing us how relentless this highly contagious virus is. A key coronavirus model recently forecast over 140,000 people in the country will die by August 4th. The sad truth is, this could have been avoided in the beginning.